Hello! Have you heard about root canal? Some folks I heard they're scared with root canal. I'm Dr. Myrna Lazaga here in San Diego. Today we're going to talk about root canal because we receive a lot of questions regarding this and we'll try to answer those questions to give you a better understanding about root canal. A root canal treatment is a procedure that we use when you have a tooth that is bothering you or you're in pain, aching pain on a certain tooth, or you have also an infection on the roots of the tooth. And so, in order to save that tooth instead of taking it out or pulling it out, we do a root canal to get rid of the infection and at the same time save the tooth and get you out of pain. Number one sign that you may need to have a root canal is pain, like aching pain on a certain tooth. And the other thing that you will also notice when a tooth is dying, it's kind of like discolored, starting to get discolored, like darker than the rest of your teeth. And then the other one, if you have big decayed or you had a cavity there that you just neglected, and of course, when there's a decay and you lift it alone, it doesn't get better, but it'll get worse, and then you end up with a root canal. A root canal can save a cracked tooth in some cases. It depends on how big is the crack. If the crack involved the roots already, then it might not be a good idea to do a root canal, and that time that tooth is not savable anymore. It is too late to have a root canal if you have decay or cavity that involves already down to the roots of the tooth, because the root is not going to be vital enough to hold restorative material after we do a root canal. During a root canal procedure, first thing is we have to make sure you're numb. And then we open the tooth. Of course, we remove the decay, and then we access the canal. That's where the nerve is, and then clean up by using special instruments. And then after we clean it up, we sealed it. It's kind of like filling down to the root. And then afterwards, we wait about like for me, I usually wait another week to touch the tooth because sometimes with the vibration, that tooth can still be sore after a couple of days. After a root canal, you definitely need a crown because once you have a root canal, pretty much the tooth is dead. So when a tooth is dead, it's brittle. That means you're susceptible to getting it fractured. The type of anesthesia that we use during the procedure is usually just local anesthesia, like lidocaine, and we make sure that you're pretty numb in that area, so that way we can proceed with the procedure with you in comfort during the procedure. Root canal is safe because we deal with the within the root of the tooth, and it's like a filling. The only difference with it fills up to the tip of the root. You can prepare for root canal, of course. Make sure that you get a good rest, because expect that you'll be opening your mouth wide as you can. That will really help. And at the same time, be relaxed. And then we do make sure that you're comfortable, so that way it'll be easy on you and also easy on us. How will you feel after the root canal? Of course, you might still be numb, because we definitely, when we do a root canal, we definitely make sure that you're really numb when we start, because to avoid you getting uncomfortable. And then after the root canal, there should not be much of a discomfort. Actually, when you're in pain because of you needed a root canal, that's a relief on your part after the root canal. The tooth that we just did a root canal, it should not be sensitive, like temperature sensitive, cold or hot. But sometimes what you will notice is kind of a little sore in there. One is because of the vibration when we clean the tooth, and then the other one, you're from opening wide. That could be more on that discomfort as opposed to sensitivity. To recover from a root canal, it will only just be like 24 hours. There are times that we don't do the restorative part right away because the material that we use to seal, it takes 24 hours to set. And so in most cases, I would just let the patient come back a week to kind of have them recover from if they have like sore from mouth from opening wide during the procedure. That would help them. The best way to recover after a root canal is when you uh, had a root canal is, of course, when your muscle are sore, is you can put moist heat on your cheek where the area had you had a root canal, or on the other side. It depends because you might be sore just from opening, but not really from the root canal. But the other thing that I would highly recommend is after the root canal, like I said, with the vibration, you can rinse with warm salt water, about 1 teaspoon of salt to a cup of warm water to help the area heal faster. Root canal is basically where still have your tooth saved. So in the case of if the tooth is still savable, we do root canal. In a case where the tooth is not savable, we have to pull it out, then that comes in the implant to replace it. That's the other pros and cons on those, of course. With the root canal, you still have your own tooth in there. With the implant, you be out of tooth for quite a while because it takes weeks for that area to heal and get the implant there stable. And then the other thing with the root canal, you'll have it restored quite within a couple of weeks or a month. You have your crown there right away. And then the implant, it takes about 3 to 6 months by the time you get a tooth in there because that tooth is missing by then. And then of course the implant side is you have to also consider the bonding of the implant and the bone. And the other thing that with the nice thing about with the implant, if in case the tooth is not savable anymore, then of course that's another option to replace that area that the tooth was not savable anymore. A dental crown is highly recommended after a root canal. Like I said, when a tooth had a root canal, it tends to be brittle. And so to avoid getting that tooth fractured, you just invested in root canal. So next thing we have to protect it from fracturing because the tooth when it's dead is brittle. The root canal cost, it varies because when you have a front tooth, there's only like one root and one canal. It differs. It's easier to do that. But when you're talking about the molar area wherein you have 3 roots and sometimes you find 4 canals or on the molars, then it gets more expensive and the accessibility back there is also more difficult. So it varies which tooth you need a root canal as far as the cost wise. We've tried to answer your questions as much as we could, but if you have any more questions, please feel free to call our office at 619-477-0570 for a complimentary exam. Thank you.